In this module, we will explore cultural diversity, cultural sensitivity, and effective communication in the home care setting. At Nobleman Care Services, we serve clients from a wide variety of backgrounds: cultural, ethnic, religious, generational, linguistic, socioeconomic, and more. Each individual brings unique experiences, values, and beliefs that shape how they interact with the world, how they respond to care, and how they prefer to communicate. Cultural diversity is not simply something we acknowledge. It is a fundamental part of providing competent, compassionate care. When you enter a patient's home, you are stepping into their world. Their customs, routines, beliefs, and values must be respected at all times, even if they differ from your own. Providing culturally sensitive care requires awareness, intention, and a genuine willingness to understand others. As direct care employees, we must be prepared to recognize how our own cultural viewpoints influence our actions, and how patient needs may vary widely based on their cultural identity. Supporting cultural diversity is not just an ethical responsibility. It strengthens trust, promotes comfort, improves patient outcomes, and ensures compliance with state and federal regulations designed to protect patients from discrimination. Cultural awareness begins with recognizing that every person has a cultural identity that influences how they view healthcare, illness, independence, family involvement, nutrition, personal space, and end-of-life decisions. For example, some cultures value large family involvement in every aspect of healthcare, while others expect privacy and independence. Certain cultures emphasize modesty, which may influence who they prefer to receive personal care from. Some patients may follow religious dietary restrictions, observe prayer times, or avoid certain medications or medical interventions based on deeply held beliefs. Cultural awareness is the ability to acknowledge these factors without judgment. It means asking questions respectfully rather than assuming you understand a patient's preferences. It means recognizing when your own habits, assumptions, or communication style may not match the patient's expectations. When cultural conflicts arise, such as when a patient refuses care due to a religious belief, it is important not to react defensively. Instead, notify your supervisor immediately. Together, you can develop a plan that both honors the patient's culture and meets their healthcare needs. Every staff member plays a role in maintaining a culturally respectful environment. This includes understanding the agency's policy, which states that no employee may refuse care based on a patient's cultural, racial, or religious identity. Discrimination in any form, verbal or nonverbal, is strictly prohibited. Because we all come from different backgrounds, it is natural to hold personal beliefs, preferences, and opinions. These beliefs shape how we see the world and can sometimes create unconscious biases. A bias is a preconceived opinion or belief about a person or group that may not be accurate. These biases can impact how we speak, how we interpret behavior, and even how we provide care, unless we actively work to prevent them. Common forms of bias include assuming someone's ability or disability based on age, expecting families from certain cultures to behave a certain way, judging patients based on socioeconomic status, making assumptions about a patient's gender roles, believing one communication style is superior to another. Each of these assumptions can interfere with the delivery of individualized care. Therefore, part of cultural competence is recognizing bias, catching it early, and replacing it with curiosity, empathy, and respect. The best way to overcome bias is by seeking to understand. Ask questions like, "How would you prefer this task to be done?" Or, "Is there anything I should know about your beliefs that would help me provide better care?" These simple questions can dramatically improve the care experience. When you demonstrate respect, you build trust, and trust is the foundation of successful home health care. Communication is one of the most important tools in patient care, but it is also one of the greatest challenges when cultural differences exist. Different cultures may express emotions differently. Some patients may speak very directly, while others may speak in a more indirect or reserved manner. Some cultures value eye contact as a sign of respect, while others may avoid direct eye contact out of modesty or politeness. Tone of voice, facial expressions, gestures, and personal space expectations can vary greatly. A gesture that seems friendly to one person may feel inappropriate or uncomfortable to another. Language barriers may also occur. Even when patients speak English, they may interpret certain words or phrases differently. Speak clearly, avoid slang, and always confirm understanding by asking the patient to repeat instructions in their own words. Be mindful of communication barriers, such as hearing impairments, cognitive limitations, emotional distress, limited literacy, stress or anxiety, strong accents or dialects, cultural expectations around speaking to healthcare professionals. When communicating, use simple, respectful language. Pause frequently to allow patients time to process information. Pay attention to nonverbal cues. Does the patient look confused, uncomfortable, or unsure? If so, rephrase or explain in another way. Effective communication is not just about what you say. It is how you say it, how you listen, and how you adapt your style to meet the patient's needs. Active listening is one of the most powerful communication skills you can use as a caregiver. It involves listening not only to the patient's words, but also to their tone, their body language, and the emotions behind what they are saying. Active listening includes making the patient feel heard, allowing them time to speak without interruption, asking open-ended questions, summarizing what they said to confirm understanding, showing empathy and patience. Patients often reveal important information, not only through their words, but through pauses, facial expressions, or subtle cues of discomfort. Paying attention to these signs helps you respond appropriately and adjust your approach. Active listening builds rapport. When patients feel respected and validated, they are more likely to cooperate with care, share concerns, and follow instructions. In home care, trust is everything. You are entering a patient's personal space, handling sensitive tasks, and potentially assisting with the most intimate aspects of their daily life. Demonstrating respect, listening carefully, and engaging with compassion helps foster a sense of safety and dignity. When communication is strong, misunderstandings are reduced, conflicts become less likely, and care outcomes improve significantly. Even with the best intentions and communication skills, cultural conflicts may occasionally arise. These conflicts may involve disagreements about treatment plans, refusal of care, misunderstandings about boundaries, or differences in expectations. When cultural differences create barriers to safe and effective care, it is important not to handle the situation alone. Notify your supervisor or the administrator immediately. Nobleman Care Services has systems in place to support both employees and patients in navigating cultural challenges. Examples of when to seek help include: a patient refuses care due to religious practices. A family insists on care methods that violate safety standards. A patient communicates discomfort with your gender as a caregiver. Cultural expectations conflict with medical directives. Misinterpretations or misunderstandings escalate into frustration. Your role is not to argue or attempt to convince the patient to change their beliefs. Your responsibility is to remain calm, respectful, and professional, then escalate the concern to someone who can assist with resolution. With appropriate guidance, care plans can often be modified to accommodate cultural needs without compromising safety or compliance. In summary, cultural diversity is an essential part of delivering high-quality, patient-centered home care. By respecting cultural differences, communicating effectively, and listening actively, you create an environment where patients feel safe, understood, and valued. Cultural competence is not achieved through a single training. It is a lifelong skill that develops through experience, compassion, and openness. Every patient you meet will teach you something new, and every interaction is an opportunity to grow. At Nobleman Care Services, we are committed to providing culturally sensitive care that honors the dignity and individuality of every person we serve. By embracing diversity, we strengthen our relationships, improve outcomes, and uphold the highest standards of professionalism and respect.